So we'll get started then. Okay, so thank you so much for joining. This is Dr. James Huang, and he's a holistic chiropractor and kinesiologist from California. I'm really excited to hear about some of his work in the ways that I've seen it really connect into the dance movement therapy field. So I would love if you'd give a brief introduction who you are, and then also what separates your work from what people might imagine a typical chiropractic experience is like.
Okay, so let's see. Well, I've been practicing for about 11 years as a chiropractor and kinesiologist. And my background is I'm an athlete. I still snowboard quite a bit, but I used to compete as a snowboarder. And I love extreme sports like mountain biking, snowboarding, skateboarding, all the board sports. And I've had a lot of injuries. And I also like to dance, and I've done some break dancing in the past. So, but I've had a lot of injuries, and through my injuries, that's kind of what developed me as a healer. It's because I've realized that the body can have physical trauma, and it can have emotional trauma or mental trauma, and it can also have chemical trauma like toxicity. So that's kind of in a nutshell. I would say what sets me apart is, one, I've been through a lot of trauma, so I can identify with my patients when they have an ankle injury or pretty much any injury I've had. I've had a concussion, I've fractured ribs, I fell 50 feet on this shoulder. I've dislocated my shoulders. I've had a lot of compression to my spine. Pretty much sprained every joint in my body. Had multiple. I've also been in multiple car accidents too. Yeah. So I'd say physical trauma. I've had a lot of trauma. So I can identify with the sports injuries that my patients have, and I've healed from all of my physical trauma. So I'm actually 41, and I don't have any pain in my body. I have zero pain, a full range of motion of my every joint in my body, and I still feel like I'm 20 or 20, even though I'm 41. So that's one thing. And then in terms of chemical trauma, I've had digestive issues in the past, food poisoning, heavy metal poisoning, EMF radiation toxicity. I mean, like it's all these different factors that affected me. So I've had a lot of symptoms, sinus congestion or infection. I think of all the major headaches. I mean, a lot of issues that are related to chemistry. So like lack of nutrition, not eating the right foods. I mean, I grew up eating McDonald's. I was sick a lot as a kid. I was very sick. I mean, I remember having a lot of allergic reactions, rashes all over my body. So I've understand that personally as well, the chemistry side. And then in terms of mentally, there's a combination of physical trauma too, because I've had a couple concussions and just a lot of severe trauma. And then even dental work can cause some trauma to the body. But I used to get headaches all the time and feel fatigue. And so that's really brain health. And so working with the brain and understanding that. So as a practitioner, I'm also a patient. And so as a patient, I've seen a lot of different practitioners all across the board in chiropractic, outside chiropractic. So that would set me apart, is just that I identify with my patients in a very deep way. So I would say that's the first thing that sets me apart. Second thing that sets me apart is my curiosity for knowledge and learning. So I've right off the bat, from right when I was ending my chiropractic education, I was mentored by the chiropractor for the Oakland A's. and he was the Oakland A's chiropractor for 31 years. So he really loved to help, people and work on athletes. So that was also very just inspiring for me, and his work ethic. And then he also was very skilled, and he was also an applied kinesiologist as well. So he was a chiropractor, holistic therapist, and kinesiologist. And I just kept wanting to learn from him. So I devoted a year to learning from him every week. And then things shifted in my schedule, and but I still wanted to learn from him. So I asked him if I could change my schedule around and devote another year to learning from him. And so I've had a lot of different mentors as well. So I'm really big on mentorship. That means that you basically have someone who's, ahead of you, maybe a couple of years or even 10 years, and you're always a student. So I continue to learn from him another year later, until he told me I learned everything that I had to learn from him. So that's very rare. I find that a lot of students, they don't keep learning until someone tells them they're done. They decide I'm done, and they just go on with their life. So I think that's a big part of what sets me apart, is my curiosity and my drive to continue to learn. I learned a lot just this week. It's like I'm always learning. So some of my students might have taken seminars from me maybe like 3 years ago, but I've already added like a whole bunch of things into my toolbox, or into the way I think. So that would be number 2, is my curiosity, just always wanting to help and learn more, and go to seminars, and also learn outside of my field. So like I learn from everybody, and I learn from my patients too. So that's curiosity. So and I think I'll add one. The third one I would say is my understanding of faith, and like more of the spiritual realm. So we're not just physical, we also have that's why they might say the mind, the body, and the soul. Like we're more than just our physical body, and that's going into the energetic side. That's why I talk a lot about, and I created my own technique called the energy specific. So it's about the morphogenic field, the biofield, it's our aura. All of that is the idea of energy and electricity. So that's like a big, big one. But that's what I think right now really sets me apart from other practitioners, that I really look at the energy of the body.
Yeah, and that energy piece is amazing, because I think it also starts to highlight things that in my field are sort of innate to what we do. Like we have very much an understanding of the connections of the mind, body, spirit, but minus maybe some of the more scientific understanding of the energy fields. And so that's really a huge piece that I would love to start bridging from your work too. So what does that look like then, working with someone's energy field? I know you also do muscle testing, different things. What does that look like in your practice?
Okay, so I'd say it starts with the idea that the body's electric. Okay, so if our bodies are electric, and we learn this in science, then that means that anything that has a voltage, you can read a voltage from, that means it has energy. It's producing some form of energy. And then anything that affects that voltage is also going to be energy. So it's as simple as a light bulb, right? A light bulb lights up. That's because there's power coming from a battery, or from a source, and then that lights the light bulb up. But the light bulb can be stronger, like a nice bright light, or it can be dim based on the power source or the connection. So if there's a disruption in the connection, that light bulb's not going to light up. So that's the same with the body. Our bodies, every time we fire a muscle, it's actually an electrical impulse, and there's energy coming through. And so if that muscle is not working, right, then there's a problem with circuit, with the energy, the electricity of that. And that's why energy can always be quantified through electricity. And this is the science behind it. And there's a lot of different seminars and techniques that talk about, that do muscle testing, and they check the field. But if you really wanted to know, you could, basically connect voltage meters to your body and test it and see what's happening, what's actually getting produced. And there's also, I have a patient and friend who does a lot of research on this, on energy and electricity, and she quantifies everything. She's a scientist, and she is in the area here, and she looks at people's blood. She does live blood scans, but she also does heart variability tests, and she's into heart math. And there's I think it's heart math, yeah. So yeah, she's a genius, and also along with her husband. And so they created all these ways to quantify energy, and they studied like people who do Tai Chi, and they studied people who I guess are like, all those esoteric type of energy workers, and she found that it was able to quantify things and to see it, and then she could do experiments. So she has the equipment to really go and do research. So she's done a lot of research on this, and she's worth checking out. Her name's Beverly Rubik. I can send you some info later.
Thank you.
So I've been a test patient of hers to test my energy, and my blood. And it was really surprising, because I know that I feel healthy, but I was able to see it objectively. And so she did a test, and it tested my heart, my blood vessels, and like I told you, I'm 41, but my blood vessels tested as if I was 8 years old. So that was very fascinating. And I remember when she saw it, she was like, oh my gosh, this is insane. Like, I've never seen anybody test so high. So it just validated what I was doing was good, like my lifestyle and everything else. So that's the science. And then there's another aspect of the science, which is our bodies are magnetic, right? And we also have polarity. So electricity always has polarity. So there's positive and negative charges, and there's a flow of energy. So just like a magnet, there's a north and a south pole on it, and it has a polarity. So if your body's alive, it's energetic, there's always going to be energy moving. Okay. So that's where they can see it. And like, so when someone's dead, there's no energy, there's no electricity. But when you're alive, there's all this movement of energy, and there's a field of energy. Just like a magnetic field, that field, if it's a big field, right, like a magnet has a strong field, it's going to pull the metal from far away. If it's a small field, it doesn't really get that much magnetic pull. And so our bodies are the same. We have a magnet, and people with all the science and research is showing that the heart is the magnet, or the big major energy source of the body, and everything kind of revolves around that. And so and then I've been to seminars, and I wrote this in a chapter of a book, that there's a morphogenic field, or the electrical field, and it can be measured from the body. And initially I thought it only went 10 feet, but in my work, I found it goes 100 feet from the body, and that's the healthiest you can be is 100 feet, 100 feet. And then if you're low energy, it basically is just coming right off your body. And most of the people who are dealing with an autoimmune issue or extreme fatigue, their energy field's very low. It's like maybe a foot from the body.
That's so interesting.
Yeah. So I test, with every visit, I test my patient's energy field. Yeah.
Yeah. I think about in my field how we talk a lot about the dyadic relationship between the therapist and client, and how you can really help people state shift even just through your presence. But that puts some of that real science behind how is your presence actually through that electromagnetic field able to impact somebody else's state, which is amazing. One thing I have seen you talk a lot about too is with the way you see emotions impact the body. What do you see in your work with that? How the body's dysregulation is impacted by emotions or trauma?
Okay, well that deals with frequencies. So frequencies are um, types of energy that exist, right? So there's always you could say there's negative energies and there's positive energies, and they have different frequencies that exist, just like light and sound. So negative frequencies would be like thoughts of hate and anger and um, sadness, depression. Those are like kind of negative frequencies, and then the positive frequencies would be like love and joy and peace, happiness. So those are energies that affect the body. And so when you deal with emotions, I mean, we should feel all emotions. It's like we should express all emotions. So it's healthy to express all emotions. But sometimes, just like a radio station, or like, well, not a radio, not a radio station, your radio gets stuck on the wrong frequency and it's getting static, right? Instead of listening to nice music, it's like, so so that happens to people. Some people are stuck in a frequency. They might be stuck in the sadness or depression frequency. So all I do is I balance the body and I allow the body to reset, and then it can go back to normal, frequencies. It's not stuck in that frequency. So there's a number of techniques that I've learned through the years, but I created my own way to do things. Yeah. So I'd say there's a lot of people that talk about and deal with emotions, but if they can't quantify it, it's harder. That's all. That's why muscle testing is a useful tool. It allows you to quantify and determine what frequency they're on and what energies are going on in the body. So it's a way to read the body or the diagnostic tool.
Yeah, you've mentioned like the different root causes, like the thoughts, toxin, trauma. So I would imagine that muscle testing is part of identifying what the root causes are there.
Yes. It makes it very easy to do. I mean, there's other methods from other techniques, but that is a universal tool. And if you look on, I think on Wikipedia or somewhere, 1 million people in the world use muscle testing as a diagnostic tool. But everybody does it different, and not everybody knows how to do it right. And there's also inconsistencies with it because it is a tool. And just like any tool, every tool needs to be calibrated. And so that's why I teach seminars and things, because I help people understand that. Because when you're doing muscle testing, you're using your body as a diagnostic tool. And so your tool, though, could be damaged. There's things that can affect it. So it may not be accurate if you don't know how to calibrate it or make sure. So this is a big issue with the whole muscle testing world. I would say, even though 1 million people use muscle testing as a tool, maybe only, I don't know, like 10,000 or so, or 50,000 actually use it accurately. So you have to be very careful.
Yes, it sounds like a really useful tool when used correctly. I think about in dance movement therapy that one of our part of our training is movement observation. And while it can be really helpful for picking up and perceiving some things that might be going on with clients, it's because it is observation based. There's a lot of lenses through which you have to filter through to really get an accurate picture of what's going on. So the different cultural aspects of movement, whether it's impacted by disease or physical ailments, different things. And so to have a muscle testing tool feels more universal in that actually being able to measure in a quantifiable way would be incredible.
Oh yeah, it is. It's incredible. I love it. And so there's it's like, I don't know how I would. Well, there's other techniques that I love. So if I didn't do muscle testing, I might like revert to one of those techniques, because again, it's all about objectivity. So some other techniques will be more objective, and they have checks and balances. So that means there's a pre and a post check. So I always pre and post check everybody. But every time I do a muscle test, I'm basically doing that pre and post. So we're looking for an improvement. And if I'm not satisfied with the improvement, I keep looking, and that's the root cause kind of mentality. I'm looking for the root cause of why is this muscle not firing? Like, why is your quad tight? Why is this, yeah, just it's kind of like troubleshooting. Yeah.
Yeah, so what are some of the common things that you see show up in people's bodies and how, like, so say troubleshooting a specific
Yeah.
muscle, and then what do you see show up as you're doing that work?
Okay. Well, there is an organization that, or no, I'll just go back. There's a chiropractor from the 1960s. I get the dates wrong, but his name was Dr. George Goodhart Jr. And he was the first chiropractor to represent the U.S. Olympics. I forget what year, it might have been in the 1980s, I think. And and he developed this idea that the body is like what we're like physical, chemical, and mental. And but what he found was that there was a connection to dysfunction. So whenever there was a dysfunction, say um, say my muscle here, so or my shoulder muscle here, the deltoid, it wasn't working. The muscle was weak, so it wasn't facilitating. And he found that it was either connected to the physical issue, like a sprain strain or a muscle tear or something like that, or it was related to an organ. So say the deltoid wasn't working, but it was because the lungs were inflamed or something was going on, or maybe there was a sensitivity to pollen, or, and so that was one aspect. The other aspect was that it was related to the brain. So it could have been because there is also the the left motor cortex controls the whole right side of the body. Okay, so that's just neurology, but also the limbic system is connected to every organ as well. So then if you have an emotion like, say, anxiety, worry, or grief, it might also shut down that circuit to the lung. And then now the lung is connected to the shoulder, so then the shoulder muscle doesn't work. So that's the mind body connection. So just say yesterday, a lot of people came in with the same symptoms, like same patterns, and they all had they've been what's the word, working too much maybe, and not enjoying life. So they or their mothers, and they've been taking care of their kids but not having any time for themselves. So they're just like busy, busy, busy. And so they were all kind of showing up the same, like they needed to be nurtured. So when that shows up, they have stomach issues, digestion, all these issues related to that idea of not being nurtured. And yeah, and it's kind of fascinating because it's always the same. It's always the same kind of pattern. The people that don't get nurtured or don't have time for themselves, they usually have digestive issues. And then if there's people who have a lot of fear and anxiety, then they have a lot of tightness up here in the trap muscles. And also, they might also have some issues with their hips, So these are common themes that I see.
Amazing, because when we learn those patterns too, so your work maybe goes that way, but mine would be looking more the opposite. So if we're having a hard time troubleshooting with clients emotionally, seeing what shows up in the body and backtracking, yeah, to the emotions there to help process what needs to be processed. So I think those patterns would be so essential to start to bring over into the mental health field as well, as it's very obviously being looked at in other fields in a way that's been really helpful for people.
Yeah.
So another thing that I've heard you talk about too is helping people shift from a parasympathetic state. um, I guess it'd be the so shift from the different states, the sympathetic
Yeah.
state
Yeah.
back into the parasympathetic state.
Yeah.
So that's a huge part of dance movement therapy. We're really use the polyvagal theory in helping with state shifting. So I'd love to hear just from your field just what you have to say on that.
Okay. Well, that if you want to I don't do this in the office because I do a lot of muscle testing and energy work. But just like I was saying before, if you get a heart variability test, then that would test whether you're in the sympathetic state or the parasympathetic state. And in sympathetic, you're going to be in fight or flight. So you're going to have constriction of your blood vessels. You're going to have hypertension. Um, you're going to have tight muscles, more hypertonic, so you're like this in sympathetic. Okay. And people go into, yeah, so that's the basic. There's fight or flight, and then they might say there's freeze. I don't really go into freeze too much, but there's like 3 states, but it's fight or flight and freeze. But the idea is that your body's not functional except for fighting, or running. Those are the only things that it's functional for in that state. And if you have a trauma, a lot of people get stuck in that state, like a car accident, or maybe they got screamed at, yelled out, or scolded for just like something silly, like as a child. And so you get, you get traumatized basically. And then, so that's a sympathetic. And parasympathetic is the rest and digest state. So that's the healing state too. So you won't heal if you're in sympathetic. So rest and digest and heal. So that's the normal state. We should be in parasympathetic all the time. So we should be breathing like slow. We should have a normal heart rate. We should have our blood vessels open, like ready to receive a hug. Instead of like hiding, we're like open. And so that's the parasympathetic state. And yeah, so you're gonna pretty much have everything opposite of sympathetic. But in terms of the body, also your ligaments are gonna work, your muscles are gonna fire, like everything's gonna be functional in the parasympathetic state. And I'm trying to think if there's other things that show up. But in terms of bringing the body into that, back into pure parasympathetic, I have a method that's more related to reflexes and like reflexology, I guess, and Chinese medicine and the meridian system. So there are certain points on the body, and if I test those points, I'll know that the patient is in parasympathetic. So it's more of an energetic electrical test that I do, and then I know for sure, okay, I'm done. But if not, I would rely on the heart variability test, and then we do that. So, and that's the beauty of how our bodies are created. They're electrical, so you can treat it like in a way like a car. And I always give this analogy: the body's like a car. So it's either physical body is messed up, like the actual structure, or the chemistry is off, like, or needs something like transmission, brake fluid, oil, or the computer system's faulty. But if you have a computer system, you can always test it. Is the computer system working? You can do like, just like on your computer, you can like do it like I forget the word, but it's like a test that tells you everything's good. All systems go. And there is ways to do that. And I learned it from other seminars and other mentors on how to know if it's working or not working just by doing muscle tests, basically. So, does that answer your question?
Yeah, absolutely. I'm just thinking how so much of what I do with clients, we identify symptoms and different those kind of key signs of hyper or hypoarousal, and a lot of it is very much it's verbally based on the client's perceptions of their experience. But to have these tools that can so much identify those things so quickly and so accurately is amazing, because then you can really know what to target and how to help the body shift into a place where it can heal.
Yeah. So basic things that you can ask if you don't have those tools is just like, how's your digestion? How's your sleep? Those, because if people are sleeping well, then, and their energy's well, then usually they're in parasympathetic, but if they're not sleeping well and they're not digesting their food, they're probably in sympathetic. So those are like just some simple ways to diagnose without doing all the tests.
Yeah, so it's hopefully that there are ways to start bringing more of it, like the different questioning and different ways to address the body holistically.
Yeah.
into the mental health sphere to help people start to build those connections between, oh, I'm experiencing this symptom in my shoulders, this might alert to that anxiety, or the digestion,
Mhm.
this might alert to that, and giving people, empowering them with the body awareness. And then as clinicians, having the knowledge and the tools to be able to provide that for the people that we're working with.
Mhm.
So I know that
Yeah.
you're kind of coming towards the end of your time, and so I really also wanted to make sure to ask how people are able to work with you. I know that you're located in California, but you also do
Yeah.
virtual
Yeah.
consults.
Yeah. Um, I mean, I'm very busy in my in-person like visits. Like I haven't even looked at how many hours I work a week, but I've increased my patient load about 40% since COVID of last year. So that's crazy. So I work 5 days a week. I used to work four, but I added way more hours. But I do have time to do a few remote sessions, so virtual. I usually do them on Wednesday mornings. I could do them on Friday mornings, but I usually try to stick with one day. Um, and then it's based off like time, because everyone lives in different places. So it all depends on like what time works, and because someone could live anywhere in the world and it would be a different time zone. So yeah, so they can connect with me on Instagram. That's probably the easiest way. And then I usually will tell them to text a number, and then from that number I can put them in the schedule. But usually that's the best way. Yeah, just on Instagram. But if not on Instagram, you can email me, Dr. James Huang, BC@gmail.com. That's another way to reach me. Um, yeah, I think that's the easiest way. Yeah, and I know that's how you found me, right? On Instagram. I don't even know.
Yes.
Okay.
Yeah, so through following your work there, and really seeing, wow, there's a lot of connections between what I do um, and your work, and wanting to bring more of your work in. So Instagram was the catalyst for that.
Awesome.
So I'll be sure to put all of that in the notes at the bottom. And then also, where are you located in California,
Oh,
in case
oh
there are
yeah,
people locally?
yeah. So I'm in the Bay Area, so I'm very close to San Francisco. I'm in a town or a large city called Walnut Creek is where my practice is. I have one day I'm in Oakland, California, but most of the time I'm in Walnut Creek.
Awesome. So hopefully there'll be people watching from even locally too that can connect with the work you do, because I think it would benefit everybody to um, be doing that kind of care both for the mind and the body.
Yes, yes. No, I love it, and I'm excited for your journey in the healthcare dance world and mental health and all that. So
Yes, thank you so much for your time and your willingness to share like this incredible knowledge.
great. Well, so yeah, so I'm gotta get. I'm actually gonna get ready for work right now and go help some people. So have a blessed day, and
Awesome, you as well.